All right. Okay. All right. So topic today, addressing structural racism in implementation. And whenever we have these types of discussions, it's super important to be able to talk about one's own positionality. And I'm going to talk about mine since I'm moderating today. So I am a gay woman with lived experience of mental illness. But the most important aspect of my identity that I need to talk about is I am white. And so while I've experienced various forms of discrimination based on some of my identities, I need to acknowledge that it's a privilege that I never have to experience racism. And I want to acknowledge that the territory on which Boston University stands is that of the Wampanoag and the Massachusetts people. The UU's campuses are places to honor and respect the history and continued efforts of the Native and Indigenous communities in Eastern Mass. And if you're not familiar with land acknowledgements, I thought it'd be helpful to just read a bit from the Duwamish tribe. They're a tribe in the Seattle area, and they have a great website, and they have a whole page about land acknowledgements, and I wanted to quote directly from them explaining. So they say, it's important to note that this kind of acknowledgement is not a new practice developed by colonial institutions. Land acknowledgement is a traditional custom dating back centuries for many Native communities and nations. For non-Indigenous communities, land acknowledgement is a powerful way of showing respect and honoring the Indigenous peoples of the land on which we work and live. Acknowledgement is a simple way of resisting the erasure of Indigenous histories and working towards honoring and inviting the truth. And I love that phrase, inviting the truth, and I think it's a good phrase to kind of bring us into our agenda and the hard work we have today. And you'll see the majority of the time we're going to really talk about trying to identify specific action steps or policy changes that we can make to current implementation strategies to start dismantling some of the structural and institutional forms of racism and other forms of oppression that exist. And then near the end, whenever I run a meeting, I always include this agenda item and really step back and say, okay, whose voices aren't here, who's not invited to the table, who's what we need to identify who's missing from this discussion so that we can figure out next steps and how to include more voices. So I sent a link to this article by Bronson and his colleagues. He's talking about increasing, or having higher priority of addressing equity in implementation science. So I thought what we would do is just go one by one. There's 10 altogether. We just go one by one, and we will open it up to feedback about specific action steps and strategies for each item. And we decided to have, do you all know how to raise your hand on Zoom? On the bottom of your screen, if you click on reaction, there's a hand. If you click on the hand, raise your hand if you want to give an answer or have a comment or question. And my colleague Melody is going to be watching for the hand raising, and she will call on people in order. So any ideas from anyone about how you link social determinants with health outcomes in implementation? Have you done it in the past, or how you're considering doing it? Yikes. Okay, so
Lisa.
Yeah, I'm trying to raise my hand. Oh, here we go. Okay, I raised my hand. I mean, I think perhaps the silence is a little bit like, because it's such a big topic, and you know, social determinants with health outcomes and implementation. So I'm thinking, okay, we're not talking. We're talking at the person level. Health outcomes. I feel like I need a little more focus.
Guys, yeah. And so Lisa, you make a great point. So obviously it's very complex. So, you know, interpersonal level, institutional level, societal level, and even intrapersonal level. So it all affects health outcomes. So you don't have to. So you can just pick one area and say, all right, when I'm studying these employment interventions, when you're writing up the data, do you link specific outcomes to racism? That makes sense?
And Marianne, I believe you were next.
Yeah, I think you just answered my question, Gretchen. I wasn't sure if we're talking here about linking social determinants within the context of doing a study on implementation science, or in the context of conducting the activity of implementation by itself. And it sounds like you're saying this item relative to the act of researching, correct?
It's all of that.
It's all of
yes.
All and any of the above.
Right.
Chaku?
Yeah. So in answer to the question that you'd asked just before I raised my hand, I think that being able to link your outcomes to social determinants really depends on how you build it into the research design and asking the questions in the first place, right? So maybe the linking social determinants with health outcomes is one of those considerations that we should have when we are setting up the study to begin with.
Right. Yep. When you're writing the grant application. Yep. Great.
Chaku?
Yes, thanks. So I really appreciate this both presentation, Gretchen. Thank you for the way in which you opened it, as well as these action steps. I think that just to give one example, our colleague who's on here, Joe Maroney, who was one of the first people I saw making a direct link between health outcomes and social determinants such as poverty, and the complete disregard of that in our mental health system. And I was just so grateful for that, and kind of rushed to kind of learn more from what Joe was kind of doing in that regard, and was so grateful for it. And I think in that same time, there was also a person in New York, her name is Ethel Davis Chambers, who was one of our advocates around cultural competence in New York State. And she said, Chaku, we need to also look at the number of people of color who are getting employment outcomes, because I'm concerned that if you just looked at all the caseloads of people, and she's talking to me in 1990 right now,
Mm-hmm.
all right? So we look at all the people who are on the caseloads of people getting referred to supported employment, and then moving on, when we went to 98 and then 2000 and then 2010, it just seemed to still be the same group of people, and none of them were people of color who were more likely to be getting employment outcomes. Yet I didn't see a lot of priority for researching that or prioritizing that. So that's the link I see as one example of an area from a scaling up perspective, whether both implementation and research we could be doing more about. And did that answer your question? Is that kind of what you're getting at?
You
Okay.
You win for item number 1.
Oh, I win. Oh my goodness.
All right, so should we move on to the second one?
I wanted to say something. I'll raise my own hand. Calling myself. And I think that one of the things that's important with the linking to social determinants is that can happen without linking. That we're by the absence of intentionality in the inclusion is linking the social determinants with health outcomes, and that kind of speaks to what Chaku was saying in terms of that if you're not looking at it, you're kind of missing the opportunity or leaving people out. And I see that Susan has her hand up now.
Great. I just want to follow up on some of what I think Lisa was trying to say and Marianne, and making sure my understanding of this call is that we were called together as part of the advisory group to give our ideas about how to ways that we might be able to assess impact of structural racism within this project. And so using that lens, what I would encourage is what I think I sent an overview around to the group at the end of January, saying, you know, the site has, the project has ways of measuring fidelity. Were the high fidelity implementations more likely to be occurring in the whiter settings, the wealthier settings, and were accessed by various racial ethnic groups proportional to what they were within the setting, you know, the clinic, whatever, or depressed from that. So these are really basic measures of what was keeping people from being there. And I would just hope that you know, the efforts of looking for what theoretically might be possible remain hinged to what the study will have data for, and making sure that if there are racial disparities in access at a given site, that while the study is live, you can go back to that site, feed back the data, point it out, and say, you know, what are you doing about this? And that's part of what can be learned from this project too. It's the how you capitalize on the variations in implementation that you're seeing across site to help inform future sites about how to attend to these barriers.
Great, thank you. So let's move on to the second item, which is building equity into all policies. So I would see this as, you know, the policies that, the policies that are applicable would be, you know, we as the trainers, as the implementers, as the researchers, the policies that we're driven by, you know, within the study, and then with, you know, within our workplace in general. So what are some examples of policies that promote equity? In this paper, they give examples of, you know, doing workplace climate assessments, you know, evaluations, that sort of thing, assessing staff for their perception of, you know, is racism, how is racism present here, and other forms of oppression. That you can see how that would be relevant to ultimately affecting the work of this project.
Haku?
Oh, thanks. Yeah, I mean, I'll just take a turn. Looks like there's a number of ideas here. So I mean, one might be just having a policy for a racial equity impact assessment as part of the, you know, implementation process, is one way to think about it. A lot of those other policies you just mentioned, Gretchen, could be a part of that as well. So essentially recognizing in each aspect of implementation or the scaling, is there a racial equity impact is the question, right? That's being asked. And if not, what needs to happen in order to do that, whether it's representation or whether it's participation or involvement, as well as, you know, metrics and some of the things you're leading to.
Thank you. I'm going to assume that those of you who unraised your hands did so on purpose. Mary Ann?
Yeah, I just want to clarify the conversation because I'm a little confused myself. So Susan, you were talking about speaking as an advisory council member for this particular project. And while that of course is relevant and important, I was also personally interested in sort of the wider question as well, which is how are we doing this in implementation science in general? Because I think some of what is occurring in our specific project may or may not be reflected in other implementation science projects. As I have to say, with some degree of reticence, I guess, that I have personally not been involved in a lot of implementation projects in which equity and race were front and center. I haven't had that experience. So for me, a lot of this is learning, obviously, as I read and listen. So I guess I'm saying relative to this project, am as interested in hearing what has happened in projects that you all have been involved in that might give us some ideas, as I am about specific recommendations for this one project. But that's just me. You know, other people may be more steeped in this than I personally am. So anyway, I just wanted to say that, Gretchen.
Thanks.
Joe?
I'm happy to make a stab at that. And I would use as an example the common finding that people who are Black are less likely to follow up with an appointment after a psychiatric hospitalization than people who are white. And I think an old way of talking about that had very much a blame the person, blame the patient aspect to it. And a way to flip that around is saying there are no doubt individual characteristics. There's also staff potentially characteristics, as well as the larger structural issue characteristics that could be underpinning that finding. And the parallel for this study would be, wow, it's going to be very interesting to see the rates at which, say, Blacks and whites get assigned a supported employment person, participate with that person, and get a job. And what the fall off in that along the way, if that varies by race, what are the ways that are other than blame the person that might account for that?
Got it. Thanks. Gretchen, do you mind if I ask somebody else just what they think about that? I was wondering if Kim and Susan had a thought about what Susan is saying.
Sure.
Is that all right, or am I interfering in the process here?
Let's ask Melody because she's keeping track of who's right,
Okay.
who's in hand.
Yeah, we can circle back to that, certainly. Joe?
Yeah, just in terms of the kind of concrete, one thing I have to state just as a general premise in implementing anything is equity is, has become the word du jour. You could define it. I think one of the problems in implementation in policies or anything is that it doesn't mean much to the world at large. So when you try to get people to do something, they say, well, what do you want to do? What does that mean? But in the real world. So, but a concrete example, and then I'll tell you sort of one of the problematic in terms of, more rehabby implementation of a policy. I was working with an IPS grant in Washington State, and we actually devoted some funds, particularly working with tribal members, to say, how does this play out in terms of tribal culture? And obviously, similar as you folks know, one tribe is not the same as another tribe, so even though you talk about, so that was a very concrete way of saying, let's try to get to a group that often doesn't get a lot of information about IPS. Now you take it to public policy. I'll give you an example from Oregon that's caused all kinds of brouhaha. They use part of their small development, stimulus funds to particularly provide small business protections for African American and Hispanic minority groups. And you can imagine the kind of suits that that came up from other small businesses, including from Native American, for example, small business owners. So you get into that kind of issue when you get into public policy. But in terms of kind of research stuff, I think part of the issue is I think you need to, well, let me say in implementation stuff, I think you need to be specific about what are you trying to do. You're trying to, affect impacts on people who are African-American and people who are Hispanic, on any group that's disadvantaged. Because I think by just using the word equity, it plays well in academia, but to my mind, it doesn't play well in terms of actual implementation efforts.
Yeah, and that's why in that document that I sent, I think to everyone last week, I divided, I cited Dr. Kamara Jones and
Right.
Talked about being able to name racism, to be able to say, how is it operating
Right.
here, and then strategizing and acting. Because that's very concrete and very specific. And it focuses on the problem, not people who,
Right.
like Susan.
Yeah, I think that was actually just I think that stuff, with the little left and right hand was much more thoughtful than the the Brownson stuff. I thought was pretty prosaic. It wasn't very specific. It didn't, social determinants are linked with health. That's why they're called social determinants of health. So to say link social determinants with health is a it's a tautology to some extent. So anyway, that's kind of my thing.
Yeah, but I will say, but there's plenty of data out there that shows that racism kills. So it is linked.
Right, but that's racism as social determinants of health and how it's affected by race, gender. That's different than saying link social determinants with health, because social determinants all, by definition, they're linked with health. Anyway, that's kind of my take on the English.
So Gretchen, this is John. I'm sorry I can't get the reaction thing to work, but going back to Mary Ann's comment and what Joe was saying, I'm wondering if there's a step even before all these steps, and that's a step of awareness and education, and starting a dialogue, with the study participant sites around this entire issue and why it's important, and what you're looking for.
What do people think of that?
I'll just Chaco. I don't know if I'll take
go ahead.
it. So whoever's next, I'll just go after. Yeah.
You can go ahead, Chaku, and then we'll go back to Mary Ann.
Okay. Yeah. And I definitely agree with John and Joe's comments, that there's a consciousness raising process that's part of this. Racism is a social determinant of health is kind of what I think I hear Gretchen trying to express, and Joe kind of trying to say, look, we need to get more concrete about how that's acknowledged and addressed. One of the comments I just wanted to make was about, I'm glad you brought up Dr. Jones' work. Part of what's important about her definitions of health equity is that she talks about it as the assurance of conditions that create outcomes, health outcomes. So part of what that means is that social determinants of health, racial equity, outcomes, it's both an outcome and a process. So the policies need to be both about the impact on the inequities that you've identified. So first step is identify the inequities that exist, racial inequities in particular, and then have a plan to chase that down somehow, but then also have policies that assure conditions are going to both eliminate those inequities, but also sustain the growth of equity, right? And what that, and a discovery of what that looks like. So there's, I think there's more to say about that, but I think I wanted to emphasize that point because there's a lot of talk about racial equity as an outcome when it comes down to metrics and some of those kind of all populations having equitable health outcomes, or in some way, but there's also policies that make that happen.
Thank you. Mary Ann.
I had my hand up from before. I was just wondering what Susan and Kim thought of what Susan Essex was suggesting, or actually it was a couple comments ago, so I might be forgetting it, but this issue about whether high fidelity items are more responded to by different groups. I wonder if there's been any information about TSW related to high fidelity, low fidelity, and demographics at all.
Thanks for asking, Marianne. Yes, Susan and I have been conferring a little bit about it. And I also want to thank you, Susan Essex. I can't see you, but I can still thank you for bringing this up, because I do think, in contrast to Marianne, I have some interest in what's happening in implementation science, but I'm especially interested in, well, what can we do to really understand this better in the context of this particular implementation study? And Susan, you gave a couple of suggestions that I think are both really interesting and very good concrete ways of going and exploring, within the context of the implementation of thinking skills for work across these multiple sites in Georgia. We aren't aware, I'm not aware of anybody that has looked at like fidelity, how the implementation of a program, the quality of the implementation might differ as a function of, say, the proportion of African Americans or other races within a sample, or for that matter, looking at the whether the enrollment in services is proportionate to the population served. I think those are good, really concrete examples of metrics that we could really measure in this study. Another point had come up in terms of talking with people in terms of the policies. I find it much more difficult to conceptualize right now at this stage how we would engage partners down in Georgia in a discussion about the policies and equity in policies. Partly because we have a huge amount on our plate right now in terms of just getting this program kind of off the ground. And second of all, I would like to have a better idea of where that dialogue might go in order to be fruitful.
Thanks for that, Kim. Before I hand this to Lisa, I just want to mention, if y'all can unraise your hand, so that when after you've spoken, it would help me know when you have a new thought, and so I don't ignore you when I should be tending to you. Lisa?
Sure. You can hear me now, right? Okay.
Yes.
Yeah, for me, I have to really think concretely, like around a particular study, because these sort of generalizations are hard for me to kind of be as a starting point. So and Chaco knows all, we both have been a part of implementing, developing and implementing interventions within OnTrack, within our early psychosis program. And, so I mean, it starts, I don't remember who said it, but someone said, getting input from all stakeholders, right? So trying to understand what, how, I mean, you're like cognitive remediation or suicide prevention or early identification, like what does that even mean to people who may be those who are being, who are supposedly going to be the recipients of these services, and to the clinicians. So, and then, making sure that, or at least having some process of, I guess, generating, I mean, it doesn't have to be agreement, but there has to be understanding. And then, I mean, so it's like, I don't know, this all seems very basic at this point, it's not, it's and sort of checking with the different stakeholders around the different pieces of your research, the intervention, the measurement, how and if what you're learning will be fed back into, improvement. And I mean, I think it anyway. So in some ways, it's implementation. Good implementation science studies do a lot of these things anyway, because that's, you know, and as long, and I think that what I see different now is, whereas, you know, it might be the focus might be on like staffing, or, you know, how much something costs, or skills, you know, now, you know, clearly we're much more paying attention to issues of racism and discrimination and cultural you know, consonance, if not competence. So, but it's the same basic principles, and then you just, you know, you have to apply it to the sort of the power structures within the team too. So anyway, that's but the devil's in the details of the individual study, and what the particulars of that of the study, you know, what you're studying, and how it may or may not relate to issues of racism.
Thank you.
All right, so let's move on to using equity relevant metrics. So one of the articles that I cited in that document I sent you last week, I thought it was a really interesting way to assess racism, and it's the Woodward article, and she and her colleagues studied equity in the context of Black veterans receiving care for hepatitis C. And you know what, and so what they did to measure it was simply ask Black veterans, did you experience racism? Did you perceive racism or bias while you were receiving this care? So it can be as simple as that. It doesn't have to be super fancy. Any other ideas about how to assess equity? And so that was very, very specifically looking at stats.
I didn't read that study, Gretchen. Can you say, how did that turn out for them? Did they actually collect that information, or?
Yeah. Oh yeah, they did.
give
And it's interesting, because what they found was that some of the veterans, when they were asked, did you experience racism? They said no. But when they further asked specific questions in the qualitative analysis, they found that actually, yes, they did. They didn't call it racism, but the way they were describing, oh, that I think that doctor was treating me differently because I'm Black, or because I've used drugs in the past, that sort of thing. So it is. I mean, it is very complex, and so in that. But that study I thought was super interesting.
Well, I mean, yeah, I mean, I guess I am interested in that. That's an example of a study that wanted to lean into the qualitative experience of what would be considered kind of individually mediated racism experiences, not necessarily their observation of a policy experience, right? Or did that?
Oh, no, actually, it's a specific article about they threw out a new framework for health equity implementation.
I see. I'll have to check it out. Well, I mean,
Yeah,
what came to mind as you were talking was about this. Oh, now I just lost it because I want to. I'll come back. Let me come back. I mean, that thought will come back to me soon. I promise.
Just let us know.
Oh, of course. I got it now. Sorry. Someone just screamed at me. All right. So here it is. There it is. A metric, for example, that I've raised, you know, for a long time personally, and advocates have, is involuntary outpatient commitment. All right. So this has a disproportionate, clear, you know, inequity in terms of who it impacts. In New York alone, Black and brown are more immediately across every region, not just New York City, the ones that are in IOC. Same is true in other states, Washington, otherwise, you know, I've seen these things. So I guess in terms of its interaction with the rest of the systemic policies, you know, the one pushback the research community did, and Lisa knows I did a presentation about this, was that it even got published in Health Affairs, was some of our colleagues said, well, those aren't really disparities because, we're actually maybe helping people get, from hospitalization into community, and, who might otherwise have, been lost to the system, So they redefined disparities based on a racist attitude about the population. So the existence of a racist policy, such as IOC, perpetuates these kind of, it becomes one of those examples of the fence on the cliff, that somehow somebody thinks that's a fence to keep people from falling off the cliff when it's actually increasing the number of people falling off the cliff.
That's very interesting. Let's see, I just raised my own hand, so I'll go by the rules. One of the things that I think of when I look at the equity relevant metrics, when we look at the trans or non-cis identified genders, and if doing a basic demographic identification of people only includes male and female as options, it's by the absence again of naming the options or having the door open for options, not even an other. We circumvent people's, we give a message that we really don't want you to identify. And that may not be our intention. We might be just using an old form is how we soothe ourselves. And instead of saying, okay, we do want to make sure that the metrics are inclusive and that we approach that hopefully by, learning from our colleagues in other fields and other specialties to increase the options for people through which people identify on whatever area of their lives that happens. Chaku, and then Kim or Susan.
Well, yeah, and I'll just, mine is more of a question now. I mean, so one of the implications of this is, and as other people talked about, might be, and I noticed that we're not talking about racial equity in this action step. It's kind of just equity. I keep talking about racial equity because I think that needs to be isolated and kind of prioritized. But the equity relevant metrics requires a prioritization at some point. And so, in an intersectional kind of sense, that gets complicated. I don't know how that's accomplished. So when I hear Kim, for example, talking about, I'm not sure how we're going to do this in Georgia. Part of that is the challenge of engaging people who don't want necessarily prioritize a population that matters less to them. So I don't know if Kim, if that's where part of what you've seen happening, but I'm just interested in that as well.
Kim, Susan, I'm not sure who raised their hand.
I did, and then I think Kim wants to say something. So I just want to be very concrete here and take advantage of the people on this discussion and how we can apply these issues or assess or collect information about these issues in this project, which is really heating up right now. So for example, how do we know if there's a lack of equity in who's enrolled in the caseloads of the people of the employment specialists that we're training right now? And then for the people they choose to deliver thinking skills for work, how do we assess if there's equity in who's being chosen? I really would like us to, if we can, kind of figure that out. And something Susan said was really interesting to me about the difference between black and white and follow-up from discharge. So I'm trying to think so if someone comes to an appointment or two and doesn't come back, do we or should we really look at race, and is there a different set of follow-up procedures we might consider or not? I have more questions than answers, and I want to take advantage of our advisory council on this issue. Did you want to say something?
No, I think, why don't we get feedback on that?
Susan?
Yeah, go ahead, Susan, yeah.
I really think if you look site by site and know the demographics of the center or the larger program the place is operating within, and use that as your expected distribution, and then observed are who's actually invited to participate, who's actually participating, who stays with it. That drop off, you won't know the reason for the drop off, but you'll know whether race was a predictor of drop off. And then if it is, I think at each one of those points, it's not going to be a one factor thing. So it could be, you can imagine some interpersonal, some within the center and more community more broadly issues that could be making that be the case. And so that's where, if you have an opportunity to debrief clients, I don't remember how the data collection works. If somebody blows off the service, are you still interviewing them? If you are, that's a great window, as is some problem solving about, for anybody who missed some and comes back, strategizing with them about what would make it, what would help you be here next time? Am I not being valuable enough to you? Is it that the buses don't run? What are the barriers? And hearing from the individual. But I think that's twofold. One is very quantitative, just being able to model the drop off by race. And then the other is quite qualitative, and it tunes what questions you would ask as you're debriefing people.
Well, one thing we just want to, one limitation is that we are not collecting, we're not collecting very much client-centered data. We're collecting involvement in the TSW program, completed sessions, and work outcomes, but we're not actually doing any direct client interviews. So we can, doing like a kind of a post, a debriefing kind of interview is difficult because we don't actually have direct access to the clients. We can do things like look at the proportion of African Americans versus whites at the different centers, and look at the relationship between both fidelity as well as enrollment of participants in TSW, as well as retention and work outcomes. We can look at all those things. But
I just want to interject one other issue, and that is the client really in this developmental project is the trainee. So I was also wondering about equity in who gets to be the trainee. I mean, I realize this is really tricky and agency level. And by the way, Susan, I appreciate all your responses, and I really value them. Thank you.
And the other thing about that, Susan, is that we could potentially ask the trainees to assess us on our ability to provide, how did you experience racism? Or, that's one thing about starting to address structural racism is assessing the structure. And so we're part of the structure. And so I want to throw that out there as just another really important thing to consider.
Mhm.
And so it is actually time to move on to our next agenda item. I know we could, this is an awesome discussion. I'm sure we could go on for hours. But I did want to just read a quote from Dr. Jones before we talk about identifying missing perspectives. She says that in evaluating these mechanisms of racism, we need to be especially attentive to absence of who is at the table and who is not, what is on the agenda and what is not. And when we note absence of, we need to take action to fill the gaps. We need to become vigilant in identifying and addressing inaction in the face of need. So with that, I'm going to open it up and just want to get some discussion going about who's not here, who wasn't invited, whose voice do we need to work on adding to this discussion?
Marianne.
Yeah, this is, Gretchen, not a direct response, but to what you're saying, but I'm trying to process all the conversation, including the missing voices. And as Susan McGurk mentioned, the focus of this particular effort is it's a developmental project to create a quicker way of moving a new intervention from bench to practice. That's the essential focus, which is why it's really focused on the agency and the trainees and the state more than on the client outcome per se. But it occurs to me that maybe what we're talking about in terms of this specific study is really information that should be included in an implementation approach. You know, in the sense that we're going to be writing a handbook of some kind at the end of this. And maybe part of what we include or part of what we need to be vigilant about is asking is how an implementation approach, such as the one that we're promoting here, needs to, for example, identify the missing perspectives and voices, establish equity related metrics. And maybe the characteristics that we're describing here are part of what we have to figure out how to integrate in our description of what this approach should be. At any rate, I just am offering that in terms of my musings at this point in the conversation.
Thank you. Chaku.
Yeah, so I'll just say, first of all, Marianne, I thought that was great. And that's an example of kind of what I think Dr. Jones intended when we, in that discussion of the assurance of conditions. So that if we focused on the processes, that's actually more aligned with the implementation science process. So there are processes that are actually going to reverse inequities, that are actually going to be like going in a different direction than, and to call into question what are more, you know, default status or natural kind of ways of doing things from an implementation perspective. So anyway, that just having said that, I just wanted to appreciate that. And I also loved this discussion. So I think just immediately, I don't really know who's at the table, to be honest. So I think that's what's hard for me to answer this question. But again, I'm going to emphasize racial equity as I believe other areas of intersectionality will show up as a priority if we isolate and prioritize racial equity and racism as one of the places to begin. So in that sense, I would say making sure that Black, Indigenous, people of color representation is part of it. And you know, something Susan said was really important, which is recognizing that even if you recognize race as a predictor of disengagement or any of the other factors, you need to make sure we're linking that to the other factors as well, not just dismissing race because other factors happen. So there's kind of a intersectional grouping that's far beyond an individual kind of notion of race as a factor. So Melanie Wall with Lisa and others have been doing some great work in that area. I just wanted, I think Lisa, that's one example of kind of rethinking how our groupings of studies and the people we're actually trying to, from a population perspective, it's not, so for example, is it is it not just the racial indicator or the racialized kind of population, but also the connection to poverty and other social determinants? Anyway, that's what I would say.
Right, and I think it's super important to highlight that all of the social determinants that you just listed are affected by racism. So, and just really highlighting the call for, instead of saying race is a vulnerability, the vulnerability is not the person's skin color. The vulnerability is the racism they experience daily, and that it's just one really important thing that we need to start doing in terms of addressing structural racism. So.
I think another way to think about this, so particularly in this project, is we can pretty easily get the data for what kind of representation is there in the trainees across race. I mean, we can cut it and slice it a number of ways, but across race, and does that reflect the people being served at that particular agency, and for the implementation team, which focuses more on leadership. And then that begins to get a bit more telling. So as you kind of go up the food chain, as it were, and does the leadership also represent the people who are being served? And then, because of the focus of this project, are people receiving services part of the implementation team? That's not set as a specific membership criteria, but I've been involved with a number of implementation projects where that was a requirement, that the voice of people being served are part of the implementation team, because otherwise it's being done to them, not with them, or done to me and not with me. And so it becomes, when we really practice our principles, we can make a lot of progress. There are no other hands raised right now.
Thanks.
Well said, Melody.
All right, so we only have a couple minutes left, so I just want to read this last slide as we talk about potential next steps. So Hassan and her colleagues talk about the importance of increasing accountability, transparency, and monitoring with mandated targets and actions on organizational, community, policy, individual, and interpersonal levels over an extended period of time. So that's obviously a lot, but it I think gets back to Lisa's point earlier in the talk, just talking about how complex this is, and there are no easy answers. So as we think about next steps, let's think about, okay, broadly, what does that mean? And also, are there specific next steps that we can kind of agree we can take in the process? So any ideas about that?
Well, one very, very, very concrete next step that we probably need to consider is actually collecting data on the race of study participants and people implementing TSW, because I believe with the waiver of the IRB and the statement that we weren't collecting, identifying information, that all we were collecting was information about numbers of consumers like enrolled and various work outcomes, but I don't think that we had actually proposed to collect information on race of either implementers or people receiving the program.
That's great, Kim.
Got to start somewhere. Right?
Yeah, no, absolutely. We won't know the inequities if we don't.
Yeah,
right? That's it.
Vasuda and Zlatka, I'm wondering if you have any thoughts about this.
Just what Kim said, that we can do it. It just means changing the protocol. So if everyone's open to doing it, then we can do it.
If you wait for everyone, you won't do it.
Everyone on the project needs to do it.
That's a
If we-
leadership moment, Vasudha.
If
Yeah.
we can do it, I think it sounds like a good idea. Can I say something else or?
John has his hand up if you,
Sure.
and then. I'm sorry, John, you're muted.
I'm wondering too, if you thought about possibly having this discussion with the trainees to see what kind of information would, assist them in terms of ensuring that there's more equity in the service delivery, more transparency, more accountability in terms of equity.
Mhm.
Great point.
Thank you. Marianne?
That was actually, John, thank you, a similar point to the one that I was going to make. It seems to me that concretely, we could have this discussion with the trainees, as well as I thought Susan Essex's point about reflecting on who gets offered, who doesn't get offered, and who misses out or doesn't follow through on some of these appointments for TSW, to sort of include this conversation as part of what gets discussed with the person in the TSW protocol might be a concrete way of trying to integrate some of this immediately. I know, Susan, what you think about that. Susan McGurk, I mean.
About collecting that, I think it's, I hope that we can, I hope we do. I think it's a great idea.
Great. Well, it is 4 o'clock, and thanks again, everyone, for taking the time out of your day to have this really important discussion, for all your ideas. And I hope that other people enjoyed the conversation as much as I did. Is there going to be another advisory council meeting, or is this the last one?
I think we're working on trying to have one if we get the no-cost extension next year.
Okay, great. So,
But I just want to say that I thank you, Gretchen, for leading this conversation and suggesting that we have it. And I see this as the beginning of a discussion rather than, the definitive discussion. So I want to add my thanks to yours.
thanks, everyone.
Yeah,
Thank
nice
you.
work. Great work, everyone. Bye.
Bye.
All right,
Thank
bye.
you.
Thank you.